one example of we met with Samantha Power. Yes. Thank you. Talked about thank you.
Nice to meet you.
Welcome, His Excellency. My name is Dr. Diane Maku, and I work on polio and education, and I'm the president of the Organization of African Public Health Professionals at CDC. Welcome.
Lydia Foreman. I'm working at the Global Health Center.
Thank you very much.
I'm on CDC. I walk out the CDC office.
Okay, everyone understands
I'm a communicator in the Office of Internal Engagement and Communication.
Needed to strengthen public health programs and effectively respond to health emergencies worldwide. We are grateful for this opportunity to meet you today.
Boss.
In counties, they can call CDC 24/7 if there's any proper emergency, and get in touch with a CDC subject matter expert anytime. A subject matter expert available anytime. So we'll keep walking to the front. So this is the leadership. It's about 230 people. It's not big enough to hold everyone, so we have so in Equatorial Province is where most of the disease is. It's mostly exonerating the Ministry of Health to help support, including this measles outbreak in Turkana, multiple colonies.
So the highest was somewhere
10, but
then
yeah.
went down.
And then it went down, a case of Rift Valley within 7 days. That's the target. Notify public health officials, and then notified. It took a long time to notify because there wasn't testing capability available. But once it was determined it was Rift Valley fever, they responded actually within 5 days. So this is a look at what were some of the bottlenecks in trying to achieve those targets, and what were some of the enablers. So every outbreak, they do a performance review. Antivirals work and our test work, and they all do so far. So it requires a centralized chain of command.
Good job.
That goes between Kenya and the United States, rooted in our history of freedom.
Of both Americans and Kenyans, our shared missions offer. As we celebrate our 60th first responders across Kenya, at HHS we recognize the critical role of.
Thank you, Your Excellency the President.
Solidarity, recognizing partnerships.
It's us for all members around the globe to be able to prevent. As a country, we have taken the steps of the CDC and now. As we sit here, the world is now from practice. Do not know the practical boundaries.
As Kenya's economy continues to grow, disease awareness in the world. We've got malaria talks available in rapid tests throughout the continent. We also want to
jobs, prioritizing female employment, but also putting in emphasis. My name is Mark Spencer, Director. Thank you so much for having us here today. And the last couple of years has allowed with our comments. I'll firstly like to start and life-saving medical devices on the African continent for the first. Now, during this time, we've managed to ensure that we've been manufacturing, and the know-how that we've had over the past couple of years, and especially after Your Excellency President.
I was amazed at what is happening here.
A proclamation that celebrates the 45-year partnership. It specifically highlights the Future Partnership Institute. So, Prime Cabinet Secretary. So I guess we got to get to work.